This is a very special interview because we select just one veterinarian to receive our Hero of the Year award. And this year, that's Dr. Judy Jasek. So, some of the things we're looking for is first, somebody who has high character, and Dr. Jasek embodies that. We also look for somebody who has effectively used ozone therapy, and she's done a good job of that. And then finally, somebody who's helped promote ozone therapy. So, not just using it, but also helping to promote it in the United States here in particular. And she's done a great job of that. So, this year we're excited to bring to your attention Dr. Jasek, who used to live outside of Chicago, Illinois, was raised there. She earned a degree, her veterinary degree, from Colorado State University, and she has practiced veterinary medicine in Idaho, in Colorado, and in Tennessee now, where she lives with her husband. So, in this interview, you're going to hear directly from Dr. Jasek, and we have some really interesting conversation. So, I hope you're able to stick with us through it and benefit from it. But just a couple of things. I've just appreciated Dr. Jasek. She's a very intelligent veterinarian, but she's also very kind and strikes me as a very honest individual. And I really, really appreciate that. She's used ozone therapy in her practices, and so she has personally treated many different pets with ozone therapy and seen enormous benefit. You'll hear some about that in a minute here. But she's also helped to be an advocate for ozone therapy and really promoted it to her clients. So many of her clients have actually come to us to say, hey, we'd love to do this at home. And that's one of the things that I think is unique about Dr. Jasek is she's really just putting her clients and her patients first. So really appreciate that. So let's go ahead and jump right into this interview.
My name is Dr. Judy Jasek. I graduated from Colorado State University in 1988, which seems like multiple lifetimes ago at this point. So 35 plus years in practice. I've been, aside from 1 3-year non-compete, been practicing that whole time. Currently doing telemedicine and just advising people on nutrition, herbs, and also other therapies like ozone therapy. Obviously, I like to help people a lot get started at home with home ozone therapy because I think it's really valuable for people that don't have that available. But I have a very strong holistic approach. I call it a terrain theory approach, where my focus is supporting the health of the pet, believing that health is the natural state of the body, and if we support the body nutritionally and do other therapies like ozone, that help support that natural healing ability, that the body can indeed, regain health rather than attacking disease, attacking microorganisms, the antibiotics, anti-diarrheals, anti this, anti that. So that's kind of my practice approach, and things that I love doing. Well, we moved to Tennessee last year to start a little homestead. So I really enjoy gardening. And we moved here from Colorado, and we did a lot of hiking and camping, and kind of didn't do much of that the first year, finding we're really missing that. So trying to get back out on the trail a little bit more. And I have a 10-month-old German Shepherd that occupies a lot of my time training. So I actually really enjoy that. I enjoy getting him out and working with him and seeing him learn and watching him grow up, and hoping he outgrows his chewing phase here soon, because he can be destructive at times.
Yeah. Great. Yeah. No, there's something really special about getting out into the woods, onto the trail, away from, hustle and bustle of life, into nature, and just relaxing a little bit. We love going up to the UP here in Michigan, which is, very secluded areas, and just doing that. And so I love that. Just share with us maybe one of the biggest accomplishments as you look back at what you've been able to do since 1988?
Wow, that's kind of a tough one. Practice occurs always like in an evolution, but I would say the piece of that for me was most significant was, so I bought a uh, full scale practice in the Denver area in Inglewood, Colorado, back in 2003. And at the time, it was a conventional practice. And so around that time, I was starting to get really more interested in more holistic approaches. And during the time of owning that was the time that I really realized how important holistic care is, and that conventional care was really about being, sort of a drug pusher, and you're really trained to be a pawn of the pharmaceutical industry. I think I really realized that being a practice owner, because you're constantly bombarded by salesmen, and the reps, the pharmaceutical reps are coming in and they buy the clinic lunch and they tell you about the latest and best drug they have, and how you can pitch it to your clients, and then how much money you can make selling it. And I think it was during that time, I think the reason that's significant is I kind of woke up and I'm like, is this it? Like, this is what practicing veterinary medicine is all about, is just pushing drugs and vaccines. And of course there was surgery and all that other stuff, but the crux of it, what was that seemed like that was the path they're going down. And I didn't like that. I said, this isn't healing. This isn't, the best we can do for our patients. And, pets weren't getting healthier. You're treating, it's just same in human medicine. You're seeing more and more chronic illness. So, in an emergency situation, like conventional medicine, sure, it shines. Your pet has a broken leg, gets hit by a car, needs to be stabilized, it's bleeding, it's in shock. You bet, you take them into the ER and they do whatever they need to do to get it stable. But for long-term chronic illness, it doesn't have a role. It really makes pets sicker, because they just end up on more and more and more medications, and they are less and less well. So I kind of during that time of owning that practice, I think opened my mind to learning more new things. And then I started attracting more clients in that were looking for alternatives. And just the fact that I was open to it, even if my knowledge base wasn't really huge in certain areas, I was attracting the people that were interested, which was an incentive to learn. And they were just happy to have a vet to work with them. And I'd learned from my clients about nutrition and raw feeding. And that's where I actually got started doing ozone therapy, because I actually had a client come in that her dog had a sarcoma removed from its leg. She was told the dog has 6 months to live, and was quoted, $8,000 or $10,000, which is probably cheap these days for doing chemotherapy and radiation and all of that. She's like, I don't want to do that. So would you do ozone therapy? And at that point, I just heard about ozone. I really didn't know much about it. And I said that to her. I said, well, I've heard about it. I don't really know much about it. She said, I'll buy the equipment. If you'll do it, I'll buy the equipment, bring it in here. It's a lot cheaper than doing chemo, and I don't want to do that anyway. So, and she actually knew a human practitioner that she worked with that was doing ozone therapy on people. She'd already asked this doctor if I could go into their clinic and shadow and see how they were using it on people, so I could learn a little bit of the practicality. So that's what I did. She knew I was just learning, and thought as long as she's comfortable with that, and she'd bring her machine in. I don't know, we were doing it 2 or 3 times a week. And Lacey, the little dog, that lived another 5 years, died of, I think it ended up being a heart condition. She lived to be 15. So it was unrelated to the cancer. And so then after I started working with her and saw how well she was doing, then I went on and got more formal training in ozone. So that was how I got my start doing ozone, and owning that practice was that sort of evolution. Then once I decided to sell that practice, because I just really didn't enjoy all the management stuff, I knew my path was going to be more strongly holistic. And, this was the way to treat pets. This was the path to healing for our pets. And it was like there's a point where you just change your philosophy. It's a mindset, you just change how you look at health and disease and how you look at your patients when they're coming in. And it's like, are you fighting disease, or are you helping to support the natural health of the body? And it's kind of like, once you make that switch, there's really no going back.
There's always things that we can point to that we would say, we wouldn't quite do it that way again, or I really learned something here. What is maybe a mistake you've made, something that you could warn other veterinarians about going down a certain path or making a certain decision?
I guess I would have to say that, I've always been kind of one to follow my heart, and more of a visionary, not a nuts and bolts person. So when it comes to running a business, and a lot of vets that want to practice holistically, you do end up having to run your own business, because there's not a lot of jobs practicing this way, very few and far between, in fact. And so as I moved more into this holistic realm, this was the way I wanted to practice, but I didn't really have a business plan around that. I wasn't looking at, okay, well, if I start vaccinating less, how is that going to impact my income? Am I going to be replacing that income? And I had a lot of financial stress for a while. That way, I did this kind of knee jerk into, okay, well, I want to practice this way. And like I said, once you realize that the way you're practicing doesn't feel authentic, I don't know that I could have kept doing it, but being a little more aware of the business nuts and bolts and the finances around that would have alleviated a lot of stress. That was a huge learning curve for me. And the other thing is, when I did decide I wanted to sell my clinic, it took me 3 years because it was holistic. So I always heard, like, business mentors and stuff say, always have an exit plan. And I'm like, what do I need an exit plan for? Because I'm not planning on going anywhere. When you do want to move on and you can't, or you've got some work to do, sometimes it takes years to get your business in a place where it presents well to sellers. So I would say, do the pain of the budget and making sure your finances are sound and you have a good business plan. That's like my least favorite thing to do, but it's very important. And my one, after I started back in, after selling that practice, I had some new non-negotiables. And one was that I'll always be able to move on if I want to, or like, I'll never be stuck in a practice situation. In that particular clinic, I'd taken out a business loan, so I had a lot of debt. I owned the buildings, had a mortgage. So it would have been very difficult to move on without selling it. And so just be aware of the business part, because we're not trained in business, and those are some really hard lessons to learn.
Yeah. So you've been in veterinary medicine just shy of 4 decades then. And that's a good thing. That's longevity in one particular area and career. How have you been able to maintain that with all of the stresses that come with running a business and doing veterinary work, where you've got lots of patients and clients who are sick, who are stressed, all of that? How have you been able to maintain that longevity?
I think the most important fundamental thing is practicing authentically. So like, when I believed that, just having a business model based on vaccinating all my patients every year, that wasn't working for me. That didn't feel authentic. It didn't feel like it was the best thing for my patients. You have to make that shift. Otherwise, you're just internally conflicted, and that's exhausting. I think that it could lead to burnout really fast, but also learning new things. So introducing things like Ozone, like, I remember back in those days, that was really fun. It was really intimidating. There's nothing I'd done before. I went to a training. This was before you were even in business, I think. I went to a training in Reno, Nevada. Frank Schallenberger, he started the American Association of Ozone Therapy. So it was multi-practitioners. It was vets and MDs and naturopaths and chiropractors and dentists and everybody learning about ozone together. And so, I think pushing yourself a little outside of your comfort zone and learning something new, even though it's a little intimidating, never done this before. With a bit of training, I felt like it was very safe, above all, do no harm. I didn't feel like I was harming my patients. I only did what I was, comfortable with. But I think pushing yourself into new things that keeps practice exciting, introducing new modalities, that always added a spark for me.
And
Another thing I think I'd add to that too, that I always haven't been very good at, but I think is super important, is the work-life balance. Like we talked before about hiking, getting outside, getting that break that's completely separate. I spend a lot more time on the computer than I ever did because I'm doing telemedicine. And I look back early in my career, and one of the reasons I wanted to be a veterinarian was I didn't want a desk job. Like, okay, well now I primarily have a desk job. So taking those breaks and getting outside, walking around, even if it's throwing the ball around for the dog for a few minutes, or getting out for those hikes and doing those things apart from work that help you feel rejuvenated, I think is absolutely essential.
switching gears a little bit to focus in on ozone therapy and how you've used it. So prior to your role in telehealth and becoming more focused on that when you were physically treating more patients, how did you use ozone therapy in your practice predominantly?
Well, I started into it because of this one cancer patient. So I started just sort of organically attracting more pets with cancer, and people looking for alternative therapies. So as far as the types of cases, I used it for a lot of, probably cancer has been probably the majority of what I've used it for, because those are the cases that I was attracting into my practice. But I used it for, any inflammatory condition, whether it's, itchy skin or longevity is another huge one. I remember over the years having many geriatric patients that would just come in maybe twice a month. And sometimes it was just rectal, or maybe we do a blood treatment, the major autohemotherapy. It just seemed like it always just gave them a little boost, and they just felt better, afterwards. And there's just no downside. There's no reason not to do it ever, even if it's an apparently healthy animal.
Mhm.
Why not help the body oxygenate better? There's nothing, no downside to that. But I jumped right in and started doing the blood treatments. So I guess I did both minor autochemotherapy, we draw a smaller amount of blood and mix it with the ozone. Then I would re-inject it. Actually, this very first patient I did that. I was not comfortable injecting it IV until I had more training. And so I just kind of stuck with that therapy initially, along with the rectal, and I injected ozone right underneath the surgical incision too. So I did all three of those for this particular patient. And then as I got more training, I started doing more of the major autohemotherapy, with drawing larger amounts of blood, mixing with the ozone, re-injecting it. I think I've done almost all. The only thing I probably haven't done is like the prolozone. I never moved into the joint injections, because by the time I would say I probably would have gotten that training, I was getting close to selling my practice. So I didn't want to get into a newer modality. But I would do the like ozonated saline, was really effective for giving for kitties, because kitties sometimes hitting the veins repeatedly on cats was challenging. They didn't take to that so well. So things like ozonated saline, like I said, injecting right underneath the tumor. I've injected it even around joints. Kind of mixed results on that one, depending on what's going on. Severely arthritic joints, it's pretty hard to reverse that. But I'd say I've used it in many different ways, depending on the patient and how the patient tolerates it.
Awesome. So if you had to choose one way to use it, one condition to treat, um, what would you choose to utilize ozone therapy on, and why?
I guess I would say that the cancer patients, maybe because that's what I've done the most of, but it's also, it's serious stuff. It's a life-threatening condition. And I've just seen Ozone provide amazing benefit where the pets, not only do they live longer, but their quality of life is so much improved with the ozone therapy. So the effects, I think, are much more dramatic in a case like that, as opposed to something like, say you have an itchy skin pet. Usually, if you get them on a healthier diet, eliminate external allergens and things like that, it can still help support. But here you're literally extending their life by using something like ozone therapy and improving. I always look at quality of life. I mean, to me, that's the most important thing. Like, say if I have a pet come in that, man, you're not touching their feet for anything, so hitting a vein repeatedly just isn't going to work. Well, then we don't. It's not worth stressing them. To do the treatments. That doesn't happen very often, but quality of life is really important. Can we get the treatments done in a non-stressful manner? And are we helping the pet, and improving their quality of life is super important.
Well, there's a lot of pet guardians looking for that. I just did a quick tally the other day on the number of pet guardians who are coming to us for ozone therapy equipment that are doing so because their pet has cancer versus everything else. And it's about 50% of all of them are coming to us because their pet has cancer. And so that tells you a couple things. Cancer is very prevalent.
Yeah.
And it also tells you there's not much they can do, like
Right.
oftentimes, or the things they can do don't have great success rates and
Right.
are hurtful
Yeah.
in other ways. So it's really a tough spot to be in for
Yeah.
people. So that's a good one. That makes sense. So when we talk about and look at ozone therapy at home, there's a couple things that are important there. One, it has to be doable for people. They have to feel like, okay, I can do this. And I find sometimes that's a little bit of a hurdle to overcome for people in their minds, at least. And then it's gotta be beneficial for their pet as well. So just talk a little bit about what you've seen as far as the feasibility that it being doable for pet guardians to do at home, and then the fact that it can be beneficial. Maybe that you have a story or two that you can relate to us as well in that area, just to demonstrate times where you've seen it be really helpful.
Yeah. I think it's like I was saying before, when I first started doing ozone, it's always a little intimidating to do something you haven't done before. But ozone therapy it's incredibly simple. I mean, even the equipment is incredibly simple to operate once you understand. I mean, I'm the type that I liked learning about all the physics behind it, and how I like to know how everything works. So I have that level of understanding. But as far as actually operating the equipment, it's incredibly simple. It's very, very safe. It's another thing, another question I get is, well, is ozone safe? Because people hear about ozone alerts and isn't it dangerous? And where it's true that breathing in, the straight ozone gas right out of the generator can be irritating to your airway. You do want to avoid doing that. The way the equipment's set up, it's very easy to avoid that. And there's in fact even safe ways to do respiratory therapy at home. I think it's very doable. I think it's very affordable. If you look at the cost of taking a pet in to get any kind of medical care, any kind of veterinary care, I think the machines pay for themselves really, really quickly for people. So as long as they can swing that upfront investment, I think it's one of the most affordable things you can use. Even in the clinic, it's extremely affordable when it comes to purchasing medical equipment. I think the huge benefit of doing it at home is people can do it so much more often. Even if people could find a practitioner, practicality, cost, time, stress on the pet, going to the clinic and all that, they're probably at most going to get in 2, maybe 3 times a week. But at home, you can be doing it 4 or 5 times a week, or if there's benefit, I've recommended the respiratory therapy so ozone gas is not safe to breathe straight, but you percolate it, you bubble it through olive oil through a special bubbler, and then it's safe to breathe. And I have seen that's probably one therapy that I've seen like so much direct benefit from, like chronic respiratory, chronic nasal discharges, cough for any reason. Sometimes pets are coughing, we don't know why. Asthmatic cats, and even things like lung tumors. I've seen some amazing results with respiratory lesions of any kind. And I think the reason is you're getting the ozone right there where the lesion is. If you've got a tumor on the spleen, yeah, you can do the blood infusions, and you're going to get some there, but it's going through the whole body. But I think with the respiratory therapy, you're getting it right there where the problem is. So seeing like an immediate result, I think the respiratory therapy is really, really powerful. For home use, like the rectal is just so easy to do. I don't think you're going to see more long-term benefits, but you're not going to see that, direct result like you can with the respiratory. One of the best results I've seen, and this is, I think, again, because of like getting the ozone in the area of the body where we need it, would be seeing a lot more anal carcinomas lately. And I've seen a couple of cases now where when clients can get the ozone, like, because they're getting it in the colon, it's not directly exposing the tumor, it's right in that area of the body. And it seems like getting that ozone in that area of the body has really helped keep those tumors from being a problem. Tumors like that, it's not so much that they spread elsewhere, but that they can physically block the ability to poop. And then that's obviously a problem. And I found that the ozone therapy there in that area of the body has really helped, I think, slow the progression of those tumors and allowed the pets to live with them for much longer than they otherwise would have. Yeah, I mean, I just think it's such a great therapy. And like I said, there's just no reason not to use it. And it's so safe. And I have more and more people that are, on board with doing it. And I think working with cancer patients, people are feeling more desperate. So they're more likely to do something that maybe is a little outside their comfort zone because they're literally trying to save their pet's life. And they're willing to do that. They've gotten they've seen the price tag on things like chemo. So then, $800 to $1,000 isn't so much to invest if, they want to do a therapy, and then, they can use it for all their future pets too. It's not just this one pet. So,
Yep.
People I work with, it seems like it's been a pretty easy sell unless they just can't swing the upfront investment. I mean, some people just can't, but for the most part, people can. So yeah, I mean, I appreciate having you guys out there, and it's a great partnership.